So we are in a time of transition in healthcare as we try to walk the walk between volume to value. There's been a large movements in this space in oncology with CMMI's advent of the oncology care model. And that's been transformative for practices in a few critical areas. One is the advent of advanced care planning for patients with advanced cancer. Being able to sit down and have a values assessment and when appropriate, have advanced care planning or an advanced directive to physicians can help them plan what their wishes are in the event that their cancer is terminal. Another is just-in-time treatment. Making space in our clinics to make sure that patients are seen in our clinics for acute care visits instead of being sent to the hospital or the emergency room means that patients are managed more acutely and that it costs less. A third is navigation from our nurses. Having nurse navigators have a closer touch with patients allows them to navigate their cancer journey more effortlessly, and that's helpful to patients. Another is health literacy. With the patients receiving treatment care plans, talking about the treatment that we will be administering, what alternatives to treatment are, what we expect their response will be, provides a level of health literacy that patients can leave the room with, because patients don't always leave the room with 100% of what their doctor tells them. And then there are some cost reduction measures that have been implemented in practice. Things like utilization of biosimilars where appropriate, not using growth factors in patients with advanced cancer, and then some dose rounding and dose banding adjustments for immuno-oncology drugs that are cost reduction measures that continue to provide high levels of quality for the patients that we serve. So what you see in sum is a transformation of care to alternative payment models, really precipitated by the infusion of resources in practices participating in the oncology care model.